Hello everyone. Have you been referred to a hematologist? What, you ask? A hematologist is a doctor that specializes in diagnosing and treating children and adults who have blood disorders, such as von Willebrand disease, hemophilia, and other rare disorders. Some hematologists work in hemophilia treatment centers, known as HTCs. Today we are going to give you the inside scoop on these HTCs to help you navigate the best care for your diagnosis journey. There are over 135 HTCs across the United States, Puerto Rico, and Guam, and they treat over 25,000 people a year who have many different types of blood disorders, not just hemophilia, despite it being in the name.
HTCs follow a comprehensive team model to prevent complications from bleeding disorders and provide care for all aspects of a patient's life. HTCs also typically have labs which can perform complex lab testing which is needed to diagnose a bleeding disorder. Treatment at an HTC can improve health outcomes for people with bleeding disorders, and while there's a team of healthcare providers at each visit, the patient is at the center.
HTCs sound pretty good, eh? Want to find one near you? Visit the CDC's HTC directory online to search for the HTC that is closest to where you live and has information about the type of providers and staff available at that HTC. If you live far from the nearest HTC, call that HTC anyway, because many offer telehealth options or outreach services to remote sites that may be closer to you. Want to find services specific for women? Don't blame you. There are HTCs that offer tailored services for the diagnosis and treatment of women with bleeding disorders. The Foundation for Women and Girls with Blood Disorders offers an online service map to locate services and see exactly the type of services offered for women.
Before making an appointment to see a hematologist, it's helpful to find out what your insurance covers. Hematologists are specialists, and your insurance may need a referral from your healthcare provider. Ask your insurance provider if the hematologist you'd like to see is in network, if you need approval before you do any lab tests, and if prescriptions are covered. You also want to bring a list of nosebleeds, gum bleeds, and photos of any bruises you experienced in the last few months. They may also ask for a list of prescription and non-prescription medications you take, or information about foods and medicines you're allergic to. We understand that the first visit to an HTC might be overwhelming, so it may be helpful to bring a friend or family member with you. Being prepared for your first visit with a hematologist can help you to feel more comfortable and ensure that you receive the quality care and treatment you need. When you visit the HTC, we encourage you to share as much information as possible and ask questions, even if it might be hard to talk about your symptoms and experiences. The healthcare provider may think you understand all the information if you don't ask questions. If information is difficult to understand verbally, ask the provider to refer to pictures or diagrams. Be sure to take notes and ask for written instructions if you're given information on treatment. We look forward to meeting you.